So in our last lesson, we looked at the blood supply to the brain, and we looked at the arterial circle of Willis. Today, we will look at the arterial supply to different parts of the body, with emphasis on the thoracic region, abdominal region, upper limbs, and lower limbs. So we'll look at the major arteries of the body and their branches. When we finish all arterial supply to the body, then we can now look at the venous drainage, because when we looked at the arterial circle of Willis, we did not discuss the venous drainage. So we didn't discuss the dural sinuses, venous dural sinuses. That is because I want us to finish all arteries, and then we would now go to veins. Now, so let's get started. Major arteries of the body. Now, in this class, we would, at the end of this lecture, our aim is that you'll be able to define what an artery and understand the principles of arterial supply, describe the aorta and its division, and list the branches from each part, and then list the major arteries and their distribution in the head and neck, thorax, abdomen, upper and lower extremities. List the main sites of arterial pulsation, and then define arterial anastomosis, describe its significance, and list the main sites of anastomosis, and then define end arteries and give examples. So that is our objective. Now, let's get started. Let's see, it's not responding. A minute. See. This is what I was trying to avoid. Let's see. So we're going to start with the aorta. In our previous class, we already discussed what the aorta is like, but today we will go in details to explain the branches or the parts of the aorta and the branches of each of these parts. So the aorta, as we said, is the largest artery in the body, and it arises from the left ventricle of the heart. The aorta carries oxygenated blood to all parts of the body, as we said in our previous lecture. But now I want you to pay attention to the parts of the aorta. So the aorta is divided into four parts. And these four parts are the ascending aorta, the arc of the aorta, the descending thoracic aorta, and the descending abdominal aorta. Again, we'll have the ascending aorta, the arc of the aorta, descending thoracic aorta, and descending abdominal aorta. So if you are asked to list the parts of the aorta, you say the ascending aorta, aortic arch, thoracic aorta or descending thoracic aorta, and then abdominal aorta. Now, from this diagram here, you would see the beginning of the aorta. So the aorta begins here at this place. This is the beginning of the aorta. And then the first part of the aorta, which is labeled number 1 here, is called the ascending aorta. Ascending because it is leaving the left ventricle and ascending upward. So that is why it is called the ascending aorta. And then after that, this ascending aorta goes upward and then turns posteriorly, goes backward like this. Now, when that happens, it forms an arch. So this is called the arch of the aorta, or aortic arch if you want. This is called the arch of the aorta. This is number 2. the arc of the aorta, and then it descends again, coming downward. Now, this part is called the descending thoracic aorta. Why? Because this descending part is still in the thoracic region, And then once this descending thoracic aorta crosses the diaphragm, passes the diaphragm separates the thoracic cavity from the abdominal cavity. So once this aorta passes the diaphragm, it becomes what is called the abdominal aorta. And then this abdominal aorta comes down, and then at the level of the lumbar vertebra, the fourth lumbar vertebra, it splits to form two arteries or two branches, which are the common iliac artery on the left and on the right side, on the right and the left side. So the four parts of the aorta are ascending aorta, aortic arch, descending thoracic aorta, and then abdominal aorta. And I'm going to show you at what level did it change, or does it change from descending thoracic aorta to abdominal aorta, or at what level does it change from aortic arch to descending thoracic aorta. And of course, you can see that some of the branches of this aortic arch here. And then we also see that this ascending aorta has will give off two branches, which we'll look at in the other slide. And then the descending thoracic aorta also has these branches, which we will discuss. And then the abdominal aorta has branches, which we will discuss, and then the common iliac artery. Good. Now let's start with the ascending aorta. So the ascending aorta originates from the left ventricle because it's the first part of the aorta. It originates from the left ventricle, and then it continues as the arc of the aorta. So originates from the left ventricle and then continues at the arc of the aorta. It has three dilatations at its base. So here, 1, 2, 3 dilatations at its base, which are called aortic sinuses. So the ascending aorta has 3 dilatations at its base, which are called aortic sinuses. Now, yeah, go ahead.
What is the dilatations?
Oh, okay. Dilatations are like expansion to dilate.
Okay.
So to constrict to dilate, okay? So they are like expansions. If you see that these 3 places they're expanded, it's bulging out, okay? Yeah. So it has 3 dilatations at its base, which are called aortic sinuses. Now, what are the branches of this ascending aorta? So the ascending aorta has only 2 branches, and these branches are coming from the aortic sinuses. So what are the 2 branches? They are the right and the left coronary arteries. Remember that we already talked about in the previous lecture the coronary arteries. We talked about the coronary arteries, and we said that the coronary arteries arise from the aortic sinuses. So here we see the right and the left coronary artery, which are going to supply the muscles of the heart, the myocardium. But these are branches of the ascending aorta, and they arise from the aortic sinuses. Even though we have 3 aortic sinuses or 3 dilatations, but only 2 branches, 2 arteries are formed from the ascending aorta. Only 2 arteries are formed from the ascending aorta, and they are the left and the right coronary arteries. So remember, ascending aorta is the first part of the aorta. It starts or originates from the left ventricle, and then it continues at the aortic arch, and then it gives off 3 dilatations, which are called the aortic sinuses, and gives off 2 branches, which are the left and right coronary arteries that go to supply the myocardium, or the muscles of the heart. Okay, let's look at the aortic arch. So the aortic arch, as we said, is the continuation of the ascending aorta. The aortic arch is the continuation of the ascending aorta, and it leads to the descending aorta. So again, the aortic arch here is a continuation of the ascending aorta, and then it leads to the descending aorta. Now, the arch of the aorta has very interesting branches. But before that, the arch of the aorta is located behind the lower part of the manubrium sterni. So this is the manubrium. This whole bone here is called the sternum or the breastbone. So this upper part of the sternum is called the manubrium or manubrium sterni. Okay, and this aortic arch, as you can see, is located behind this manubrium of the sternum. So you see the aortic arch here, see the curve behind this bone. So anatomically, you should know, if they ask you where is the location of the arch of the aorta, you would say the arch of the aorta is located behind the manubrium sternum or manubrium sterni, or the manubrium of the sternum, and on the left side of the trachea. So this is the trachea here, this air pipe or wind pipe. This is the trachea. Okay, now this aortic arch is on the left side. So this is the trachea in the middle like this, but the aortic arch is on the left, to the left side of the trachea. So anatomically, aortic arch is located behind the manubrium of the sternum or the manubrium of the breastbone, and on the left side of the trachea or the wind pipe. Okay, good. Because they're going to ask you in exams to describe the anatomical location of the aortic arch. So you should remember what I just said now. Behind or posterior to the manubrium sterni, and on the left side or laterally to the trachea. Okay, good. Now, so what are the branches of this aortic arch? We already mentioned them in the previous lecture. So we said we have the Brachiocephalic Trunk, and then we have the left common carotid artery and the left subclavian artery. So on the right side, the aortic arch gives rise, this number one here, this big artery going up here is the brachiocephalic trunk, right? Good, on the right side. And then on the left side, it gives off the left common carotid artery, and the left subclavian artery, and the left common carotid artery. Later, this brachiocephalic trunk will split to right subclavian artery and the right common carotid artery. Good. So 3 branches of aortic arch: brachiocephalic trunk on the right, left common carotid artery on the left, and left subclavian artery on the left. Okay, good. So let's look at the common carotid artery. So we said the common carotid artery, where is the origin? It originates from on the left side. Now, on the left side, the common carotid artery on the left originates directly from the aortic arch. As we see here, left common carotid artery originates directly from the aortic arch. But on the right side, the common carotid artery originates from the brachiocephalic trunk, as we see here. Okay, right common carotid artery originates from the brachiocephalic trunk, as we see on the right side. Now, each common carotid artery divides into 2 branches, which we already said in the previous lecture: internal carotid artery and the external carotid artery. So here, this left common carotid artery splits into left internal carotid and right and left external carotid. Okay, so this common carotid splits into left internal carotid and left external carotid, which is not labeled in this diagram. Okay, good. And we already said internal carotid is going to supply the brain, yeah? They form the circle of Willis. And then external carotid supply the face and other parts of the head. So let's look at the external carotid artery. Now, the external carotid artery, it divides behind the neck of the mandible, okay? Divides behind the neck of the mandible into two terminal branches. So here, look at this diagram here. We said from here, we have the common carotid artery, then we have the internal carotid artery, and then we have the external carotid artery. So this external carotid artery gives off a lot of branches, okay? And then it terminates, now watch this, it gives off two terminal branches, which are the maxillary artery. So this one coming to the maxilla is the maxillary artery, which is a terminal branch. So terminal branch means end branch. It terminates. So the external carotid artery would terminate as two branches. Maxillary artery going to supply the maxilla, the muscles of the maxilla, and the superficial temporal artery. This is superficial temporal artery going to supply the temporal region, okay, of the brain, the temporal region of the brain. Now, temporal and superficial, and maxillary artery. Superficial temporal and maxillary artery are the two terminal or end branches of the external carotid artery. So if you are asking an exam, what are the terminal branches of the external carotid artery? You said they are the superficial temporal artery and the maxillary artery. Even though this external carotid artery has other branches, we only just mentioned the two terminal branches first. So what are the other branches of these external carotid arteries? So the other branches of the external carotid artery are the superficial, we already mentioned superficial temporal artery, but this superficial temporal artery goes to supply the scalp and the temporal aspects of the brain and the head. Then we have the facial artery. So the facial artery supplies the face. The facial artery supplies the face. In this diagram, you would see this branch coming here. This is the facial artery. This one, facial artery, because it is going to supply the face. So most part of the face will be supplied by this facial artery. All the muscles in the face will be supplied by this facial artery. Now, it means that your facial muscles can only function when this artery, this facial artery, brings blood to them. So, facial artery comes to the face, and then we already mentioned the maxillary artery, which goes to the maxilla, as I said here. And then we have the lingual artery, which is going to supply the tongue. So here you find the lingual artery, this one here, this branch is the lingual artery, is going to supply the tongue. And then we also have the thyroid, the superior thyroid artery. Superior thyroid artery. Now, that superior thyroid artery is going to supply the thyroid gland, as the name implies. It's going to supply the thyroid gland. Let me see if it is labeled in this one, in this picture. The superior thyroid is not labeled in this picture, but it's supposed to be come down. It's supposed to come downward, because you have your thyroid gland in front of your neck here. That's where you have your thyroid gland, close to this hyoid bone. So there's a branch that's supposed to come down here to supply the thyroid gland, which is called the superior thyroid artery. That is the name of the branch that goes there, superior thyroid artery. So how many branches have we mentioned? Superficial temporal, maxillary artery, facial artery, lingual, artery, superior thyroid artery, superior thyroid artery. So these are the main branches of the external carotid artery. They are the main branches of the external carotid artery: lingual artery, facial artery, maxillary artery, superficial temporal artery, and superior thyroid artery, which is supposed to come here to supply. Okay, it is labeled here. This is it. Oh no, they labeled only the inferior thyroid artery. So this is the inferior thyroid artery. Superior thyroid artery is supposed to be around here, supplying the thyroid gland. Okay, let's go ahead and see the other branches. 1 minute. Okay. So let's look at the internal carotid artery. Yeah, by the way, if you are asking an exam, which artery supplies the scalp, the face, the maxilla, the tongue, and the thyroid gland, it is the external carotid artery. Or if they ask you, what part of the body does the external carotid artery supply? So it supplies the scalp, the face, the maxilla, the tongue, and the thyroid gland. Then you can now mention specific arteries. So the scalp, superficial temporal artery and its branches, the face, the facial artery, the maxilla, the maxillary artery, the tongue, the lingual artery, the thyroid gland, the superior thyroid artery. Okay, now the internal carotid artery. Now this one has no branches in the neck. It has no branches in the neck. It enters the cranial cavity, joins the basilar artery to form, okay, join the basilar artery formed by the union of two vertebral arteries, which we talked about in our last class. Okay, now the internal carotid artery, together with this basilar artery, forms the arterial circle of Willis, which we discussed in the previous lecture. And then this internal carotid artery supplies the brain, the nose, the scalp, and the eye. And we mentioned some of the branches in our previous lecture. So here we have the left internal carotid artery and the right internal carotid artery. So this artery gives off the ophthalmic branch, the middle cerebral artery, the anterior cerebral artery, and the posterior communicating artery gives off these branches. And these branches, together with the posterior cerebral artery from the basilar artery, form the circle of Willis, together with the anterior communicating artery from the circle of Willis, which we already talked about before. So internal carotid artery supply brain, nose, scalp, and the eye. Okay. Now, there is another branch which is called the subclavian artery. So the subclavian artery, as you would see, if you look at this diagram here, you notice that this brachiocephalic artery here gave rise to common carotid artery and subclavian artery. So this is, we're looking at the right brachiocephalic artery now, because we said on the left side, the common carotid artery and the subclavian artery arise directly from the aortic arch. But here we see the brachiocephalic trunk giving rise to common carotid and subclavian. So that tells us that this is the right brachial, this is the right side, okay? Now, which is what is here. So this is the brachiocephalic trunk here, which gives rise to right common carotid and the right subclavian. We just talked about the common carotid now, which continued and split into the internal carotid and the external carotid. And then we saw the branches of the internal and the external carotid. So this branch here, this brachiocephalic trunk, does not only supply the brain, because this carotid is going to supply the brain, but it has another branch, which is the right subclavian artery, which is going to supply the arm or the upper limb. Okay. Then the left subclavian artery also going to supply the upper limb, while the left common carotid is going to supply the brain, as we already said. So subclavian artery, it is the main source of the arterial supply of the upper limb. So if you are asked what is the main source of blood supply to the upper limb, it is the subclavian artery, subclavian artery. And here, if you look at this picture, why is it called subclavian artery? You see that this artery this is your clavicle, yeah? So this is your clavicle. So you see that this artery is running below the clavicle. So it is called subclavian. Subclavian. It comes from the Brachiocephalic Artery and then runs below the clavicle. So it is called the subclavian artery. Origin. On the left side, it arises from the aortic arch directly, as we see here. Left subclavian artery arises directly from the aortic arch, but on the right side, it arises from the brachiocephalic trunk. Now, at the lateral border of the first rib, it is continuous in the axilla as the axillary artery. So immediately the subclavian artery crosses the first rib, it changes from subclavian artery and becomes what we call axillary artery. So here, this artery now is axillary artery. Here it was subclavian artery. Immediately it crosses the first rib, it changes its name and becomes axillary artery. So brachiocephalic artery gives rise to subclavian artery. Subclavian artery runs, crosses the first rib and becomes axillary artery. Okay, and then gives off branches. So what are the branches? What are the branches of the subclavian artery? The first branch of the subclavian artery, as you would see here, we have a thoracocervical trunk. This is a whole trunk, thoracocervical trunk, and then we have the vertebral artery. So this vertebral artery is what goes to form the basilar artery that now forms the posterior cerebral artery that form the circle of Willis. So this vertebral branch, this vertebral artery will become the basilar artery later and then form part of the circle of Willis. So here, main branches of subclavian artery, we have the vertebral artery, which goes to supply the central nervous system. And then we have the internal thoracic artery that supplies the mammary gland and the thoracic wall. So here you see this branch coming down here. This branch coming down here is called the internal thoracic artery. So it's supplying the chest region, the walls of the thoracic region, and the breast. So the mammary gland receive blood supply from the internal thoracic artery. So remember, subclavian artery will give rise to the vertebral artery, which goes to supply the brain, and then the internal thoracic artery, which supplies the mammary gland and the thoracic wall. Okay, now upper limb. So what are the arteries of the upper limb? The arteries of the upper limb, that is your hand, your arm, and your forearm, yeah? Now, this whole place like this is your upper limb. So what are the arteries of the upper limb and where are they coming from? Now, the arteries of the upper limb, the first one is called the axillary artery. And we already said that this axillary artery is a continuation of the subclavian artery. So this axillary artery here, which is a continuation of the subclavian artery. So axillary artery is a continuation of the subclavian artery. It passes through the axilla and continues in the arm as the brachial artery. So look at what happens here. This axillary artery now in the axilla, and then it leaves the axilla and continues downward to the arm, your forearm. It comes to your arm and it becomes what is called the brachial artery. So this is it becomes a brachial artery. So if we trace the brachial artery backward, we would get to the brachiocephalic artery. So brachial artery was formed from axillary artery. Axillary artery was formed from subclavian artery. Subclavian artery was formed from brachiocephalic artery. And brachiocephalic artery was formed from aortic arch. And aortic arch was formed from ascending aorta. And ascending aorta begins from the left ventricle of the heart. So you see the whole continuation of the artery. So the same aorta that left the left ventricle of the heart is what is coming down to become brachial artery now at this point. After the brachiocephalic trunk gives rise to subclavian artery, subclavian artery becomes the axillary artery in the armpits or the axilla. And then once it comes down into the arm, it becomes the brachial artery. Now, that is why this artery was called brachiocephalic. Brachiocephalic. Why? Because a branch of it will come to the hand or the arm to become the brachial artery. While a part of it, which is this common carotid artery, will go to the cephalic or the head region, go upward. That is called brachiocephalic. Two branches. One, common carotid going upward. Two, subclavian coming downward to become axillary and then to become brachial artery. Now, the brachial artery descends close to the medial side of the humerus. So this muscle, this bone here, yeah, this is your humerus, this bone of the forearm. Now, on the medial side of that forearm, the brachial artery descends. So you can see that the brachial artery is medial to this bone called humerus. So the brachial artery descends on to the medial side of the humerus and then passes in front of the cubital fossa. So the cubital fossa is your elbow joint, the anterior part of your elbow. That fossa there is called cubital fossa. So the brachial artery passes in front of the elbow joint or the cubital fossa. And then at the level of the radius, so you have your ulnar bone. This bone here is the ulnar bone, and this bone on this side is the radial bone. Now, at the level of the neck of the radius, so the neck of the radius is a little bit, is somewhere here. At the level of the, at the level of the neck of the radius, so this bone is the radius. At the neck of the radius, what happens? The brachial artery divides. So watch, at this point, the brachial artery will divide and become two arteries, radial artery and ulnar artery. So brachiocephalic, subclavian, axillary becomes brachial as soon as it passes the cubital fossa. At the level of the neck of the radius, it splits into radial and ulnar artery. So the artery that started from here comes down to supply the whole of the upper limb. Now, so the terminal branches of the brachial artery are the radial artery and the ulnar artery. At the level of the neck, it divides into two terminal branches, are the radial artery and the ulnar artery. Then this brachial and ulnar artery come together to form a palmar arch. So we'll have the deep palmar arch and the superficial palmar arch. So the superficial palmar arch will supply muscles of the superficial compartment of the hand, while the deep palmar arch will supply the deep muscles of the hand, which you already did in anatomy, previous anatomy class. So all the muscles of the hand here are supplied by the deep palmar arch and the superficial palmar arch, and then they give off branches, which are called the digital arteries. So all the muscles of the digits are flexor digiti minimi and all of those muscles will be supplied by the digital arteries. Good. So this is blood supply to the upper arm. So if you are asked to explain the blood supply to the upper limb, you say that the blood supply to the upper limb actually begins as the brachial artery, which is the continuation of the axillary artery. And then the brachial artery, after passing through the cubital fossa, splits to form the radial artery and the ulnar artery. And then the radial and ulnar artery form deep palmar arch and superficial palmar arch, and then digital artery. But there was one artery we didn't mention. Now, if you look at this place, before this brachial artery, got to the cubital fossa, it gave up a deep branch, which is called profunda brachii artery. Profunda brachii artery, which comes to supply some of the muscles of the upper limb also. So profunda brachii artery. So this is a continuation of brachial artery, but a part of it comes to form the profunda. Profunda means deep, so deep brachial artery. So it's going to supply the deep muscles of the upper limb. Okay. So now we said that the terminal branches are the ulnar artery and the radial artery. So the ulnar artery is the larger terminal branch of the brachial artery, while the radial artery is the smaller terminal branch of the brachial artery. Then the palmar arches are formed by both ulnar and radial arteries, superficial palmar arch and the deep palmar arch, which we already saw here. So the ulnar artery is larger than the radial artery. Good. So now that is blood supply to the upper limb. And this blood supply to the upper limb, remember, it is coming from the, we started from the Brachiocephalic Trunk, which comes from the arch of the aorta. But we said that the aorta has 4 parts. Yeah, the aorta has 4 parts. We said that we have the ascending aorta, aortic arch, descending thoracic aorta, and descending abdominal aorta. We have only just looked at the ascending aorta with the 2 branches, right and left coronary arteries, and then the arch of the aorta with its 3 branches, the brachiocephalic trunk on the right, and then the left subclavian artery and the left common carotid artery. So now we need to now look at the descending aorta, or the descending thoracic aorta and its branches. So the descending thoracic aorta is the continuation of the aortic arch, as you can see here. Descending thoracic aorta is the continuation of the aortic arch at the level of the 12th thoracic vertebra. It passes through the diaphragm and continues as the abdominal aorta. Now pay attention to this. At the level of T12, which is the 12th thoracic vertebra, what happens to the thoracic artery? It passes through the diaphragm and it continues as the abdominal aorta. So this is descending thoracic aorta. Now, when it gets to the level of the 12th thoracic vertebra, it will pass through an opening, hiatus, okay, pass through the hiatus of the diaphragm, and then it will become the abdominal aorta, or the descending abdominal aorta. So know that both thoracic aorta and abdominal aorta are descending, they are coming downward. Now, what are the branches of the descending thoracic aorta? So they are the pericardial branches, or the pericardial arteries, the esophageal arteries, the bronchial artery, and the posterior intercostal artery. So here you find the bronchial branches, which are going to supply the bronchial tree, the bronchus, yeah, the bronchial tree, the main bronchi, and then the segments of each of those bronchi. Then we have the esophageal arteries, which are going to supply the esophagus. And then we have the posterior intercostal arteries, which are supplying the intercostal muscles around the rib cage, okay? And then you have the pericardial branches, which are going to supply the pericardium, which we said is the muscle or the layer where the heart is found, where the heart is located. And then it also gives off some phrenic branches, and these phrenic branches are going to supply the diaphragm. Good. So let's quickly remember that. Descending thoracic aorta will give off pericardial branches, esophageal branches, bronchial branches, and posterior intercostal branches. These are the main branches. Of course, there is also a phrenic branch that goes to supply the diaphragm. But know that at the level of the diaphragm, once it crosses the diaphragm, it's no longer descending thoracic, it becomes descending abdominal artery. So at what level does the descending thoracic aorta change to descending abdominal aorta? At the level of T12, which is the 12th or the last thoracic vertebra. Now, descending abdominal aorta. So the descending abdominal aorta, it enters the abdomen through the aortic opening of the diaphragm, which I talked about before, the hiatus of the diaphragm. Now, descending abdominal aorta enters the abdominal region through the aortic opening at the level of T12, 12th thoracic vertebra. So here, this, you see this dome here, this large dome here, this is the diaphragm. This is the diaphragm, and this diaphragm is what separates the abdominal region from the thoracic region, which is on top of it. So here you find this descending abdominal aorta. It came from the thoracic cavity and passed through the opening in the diaphragm into the abdominal region. Now, this descending abdominal aorta will come down here. When it gets to the level of the 4th lumbar vertebra, L4, at the level of L4, it will split into two: the common iliac artery on the left, on the right, and another common iliac artery on the left. So we have left and right common iliac artery. So this is the common iliac artery, this one here, common iliac artery, and the common iliac artery will now split again into external iliac and internal iliac, external iliac, to go and supply the lower limb and the pelvic region. So what are the branches of the descending abdominal aorta? Now, the descending abdominal aorta has two types or two groups of branches. We have single branches and paired branches. So if it is a paired branch, it means that it's going to supply paired organs. So for example, we have the kidney. The kidney will have a left and a right kidney. So we need paired branches to supply both of them, while single branches go to supply single organs. So descending abdominal aorta is a continuation of descending thoracic aorta. It enters the abdomen at the level of T12 vertebra through the aortic opening of the diaphragm, or what we call aortic hiatus of the diaphragm, and then runs downward, get to a level of L4. After giving off some branches, get to the level of L4, and then divides into two common iliac arteries, left and right common iliac artery. So what are the single branches and the paired branches of the abdominal aorta. Remember that the abdomen will have a lot of organs. That you have your kidney, you have your liver, you have your spleen, you have your stomach, you have your intestine. All of them will be supplied by branches of this abdominal aorta. So let's go see the branches. So what are the single branches of the abdominal aorta? The first branch, we have this, what we call the celiac trunk. Now, the celiac trunk does not supply only one organ. It supplies a couple of organs. And what are the organs? It supplies the stomach, the liver and the pancreas, and the spleen. So blood supply to the spleen, liver, pancreas, and stomach are from the celiac trunk. And the celiac trunk is a branch of the abdominal aorta. And the abdominal aorta is a continuation of the thoracic or descending thoracic aorta, which is a continuation of the aortic arch. Yeah, good. So the left gastric artery goes to supply the stomach. So remember, what artery supplies the stomach? It is the left gastric artery. It goes to supply the stomach. And then the hepatic artery goes to supply the liver and the pancreas. And then we'll have the splenic artery. Now, this diagram here is not, the labeling is not too clear, but let's see if we can identify the celiac trunk here. So first, we said that the stomach will be supplied by the left gastric artery. So here we're supposed to have the celiac trunk. So this is the celiac trunk, which will give rise to the three main branches. One going to the stomach will be the gastric artery. One going to the liver will be the hepatic artery, and one going to the spleen will be the splenic artery. So here you have the celiac trunk with these three branches. So this is the celiac trunk here. So that's the first branch of the abdominal aorta, celiac trunk. The second main branch of the abdominal aorta, single branch of the abdominal aorta, is called the superior mesenteric artery. Superior mesenteric artery. So this goes to supply your small intestine and your large intestine. So it supplies the pancreas, the small intestine, duodenum, jejunum, and ileum, and then supply the large intestine. But what part of the large intestine? The ascending colon and right to third of the transverse colon. So remember, your large intestine has an ascending colon, a transverse colon, a descending colon, and a sigmoid colon. But only the ascending colon and the right to third of the transverse colon are supplied by the superior mesenteric artery. Your descending colon and your sigmoid colon are not supplied by the superior mesenteric artery. They are supplied by the inferior mesenteric artery. So the inferior mesenteric artery will supply the large intestine also, but what part? The remaining 1/3 of the transverse colon. Part of the transverse colon, 2/3 of the transverse colon was supplied by the superior mesenteric artery, but the remaining 1/3 of the transverse colon is supplied by the inferior mesenteric artery, and then the descending colon is supplied by the inferior mesenteric artery, and then your rectum and the upper half of the anal canal are supplied by the inferior mesenteric artery. If you understand the structure of the large intestine, just know that the first two parts, the ascending part and the 2/3 of the transverse colon, are supplied by superior mesenteric artery, while the remaining 1/3 of the transverse colon and the descending parts, descending colon, the rectum, and the upper half of the anal canal are supplied by the inferior mesenteric artery. So three main branches of abdominal aorta: celiac trunk, superior mesenteric artery, and inferior mesenteric artery. And each of them now have their branches. Okay, so we have the left gastric, hepatic artery, splenic artery. Yeah, good. Then we'll have the duodenal artery, and each of them have their different supply. So here you would find the inferior mesenteric artery. This one here is the inferior mesenteric artery. This one here is the superior mesenteric artery. Superior mesenteric artery, inferior mesenteric artery. Okay, so what are the paired branches? The paired branches of the abdominal aorta. The paired branches of the abdominal aorta are the inferior phrenic artery, which is going to supply the diaphragm, the suprarenal artery, which is going to supply the adrenal gland or the suprarenal gland on top of the kidney. Then you have the renal arteries, and then you have the gonadal artery, testicular or ovarian artery, and then the common iliac artery, which we said is the terminal branch. At the level of L4, the abdominal artery will terminate as the right and left common iliac artery. So why are they paired branches? Because they are supplying paired organs. Even though the diaphragm is one organ, one big muscle, but it has two domes. So that's why we'll have inferior phrenic artery on the right side and on the left side. Suprarenal, because we have two adrenal glands. Yeah, so it is paired branches because one will come to this one here, coming here, is coming to supply the adrenal gland. So this is the right suprarenal gland. This artery will be the right suprarenal artery. And then on this side, you have the left suprarenal artery. Then we'll have the testicular that goes to supply the testes. And then we have the ovarian that goes to supply the ovaries. Then we'll have the common iliac. Okay, we'll have the renal also, which goes to supply both kidneys. So that's why they are paired. And a common iliac, because one is coming to the left leg and the other one to the right leg at the level of the L4, as it were displayed. Okay, so maybe in the next lesson, we would look at the common iliac arteries, which we said are the terminal branches or the last branch. So these are the common iliac artery, which are the terminal branches of the abdominal aorta. So quickly, let's do a revision. We said that the aorta had four parts, and these four parts of the aorta are the ascending aorta, the aortic arch, the descending thoracic aorta, and the descending abdominal aorta. So that is four parts of the aorta. The ascending aorta begins from the left ventricle, and then it continues as the arch of the aorta. Before continuing, it gives two branches, right and left coronary artery. Then the arch of the aorta gives the trunk, the brachiocephalic trunk, yeah, on the right. So this innominate artery here is brachiocephalic trunk, okay, on the right. Another name is innominate artery, brachiocephalic trunk. And then on the left, it gives left subclavian artery and common carotid. And then it comes down and becomes the descending thoracic artery, and then it runs down to the diaphragm at the level of T12 vertebra, and it becomes abdominal aorta. And then the abdominal aorta runs down and gets to the level of the L4 or the fourth lumbar vertebra and splits to form right and left common iliac arteries. And each of these arteries give their branches and they supply different organs. So in our next class, we would look at the common iliac artery and then its branches and how it continues down to the lower limb. And we would also do a revision. So in my next class, you are going to tell me the branches, the names of these arteries and their branches. And you will tell me also at what level does the aorta change from the ascending aorta or from the aortic arch to the descending thoracic aorta, and at what level does it change to abdominal aorta? At what level does the subclavian artery become the axillary artery? And at what level does the axillary artery become the brachial artery? And at what level does the brachial artery split to give me the radial and the ulnar artery? So you will tell me all of this in our next class. Do you have any question?
No, sir.
Okay, good. So try and read, watch the video again or go through the slide again, because there are a lot of things a lot of names we mentioned today, so you don't forget them. Okay, thank you very much. That will be the end of our class for today.
Thank you, sir.
Yeah, bye.